Hi guys. So
Rahul, what do you like the most in me?
आपकी smile.
Oh, somebody likes my smile.
Yes. And आपकी smile पे ही मर गया था मैं.
Oh, nice.
Exactly.
Hello guys.
Hi guys. Hi Vaibeshwar. Okay.
He's Jatin.
आज यार I'm talking about the Instagram profile. Hi guys. Hi Deepak. And hi Sahil. Hi everyone. Thank you so much for joining in.
So guys, Rahul अभी बता रहा था that he fell for my smile, which I also personally find very attractive, very beautiful.
ज्वाइन करने दो, फिर हम एक बहुत बढ़िया टॉपिक के बारे में, स्माइल से रिलेटेड ही एक टॉपिक के बारे में बात करेंगे. आज कॉन्वर्सेशन करेंगे एक प्रोफेशनल के साथ, डॉक्टर के साथ, राइट?
Yes, super excited.
Let the people join in. Hi guys, hi Lalit, hi Photo Hub. यार बहुत टाइम बाद हम लाइव आए हैं आज. तो इससे पहले आप में से किसी ने हमारा पहले वाला कोई लाइव ज्वाइन किया है तो डू कमेंट.
वैसे कल राहुल का बर्थडे है. Are you excited, Rahul?
यस, इसने मुझे एक गिफ्ट भी दिया है बहुत अच्छा. वो हम दिखाएंगे स्टोरीज में बाद
अभी
में.
डाला नहीं आपने स्टोरी?
नहीं.
Okay, we've made the story. अभी थोड़ी देर में after this live we'll put it.
Okay.
Okay, so let's start talking about why we've actually
come live
today.
तो कल आपने क्रिएटिव देखा होगा हमारी फीड पर. वो क्रिएटिव लाइव का ही रिमाइंडर था कि हम आज लाइव होने वाला है 4:30 पर विद अ डॉक्टर फ्रॉम क्लोव डेंटल इंडिया, डॉक्टर किरण. तो आई जस्ट इंट्रोड्यूस हर राइट अवे इन अ फ्यू मिनट्स. लेट मी जस्ट इंट्रोड्यूस कि हम क्या करने वाले हैं इस कॉन्वर्सेशन में. तो टूथ से रिलेटेड बहुत सारी प्रॉब्लम्स होती हैं हम सबको, राइट? एंड
यही वो सबसे बड़ी चीज है जिसको हम निग्लेक्ट करते हैं. मतलब everybody will go to dermats, they will go to normal doctors to get their full body checkups, they will go to the dermats to look pretty, get all of those things for their face and body. But अपने दांतों को, जो कि सबसे important और crucial part है आपकी बॉडी का, सब लोग इग्नोर कर देते हैं.
बीइंग अ फैशन एंड लाइफस्टाइल इन्फ्लुएंसर, हमारे लिए जो स्माइल है ना वो बहुत ज्यादा इंपॉर्टेंट है.
सबके लिए आपका फर्स्ट इम्पैक्ट ही किसी पे तब पड़ता है जब आपका एक बहुत ही प्यारा सा ब्यूटीफुल सा स्माइलिंग फेस सबको दिखाई देता है.
और जैसा कि मैंने बताया, मैं तो आपकी स्माइल पे पहले ही मर गया था.
आई एम वेरी कॉन्शियस अबाउट माई स्माइल. Are you conscious about your smile?
Yes, I am. तो देखो
मेरा आगे से एक टीथ जो है वो ऐसे क्रूकेड है, लाइक टूट गया था बचपन में. मेरे भाई ने मुझे धक्का मारा था और मैं गिर गई और मेरा टूट गया था. एंड मेरे को इसलिए बहुत कॉन्शियस फील होता है अबाउट हाउ माई फेस इज लुकिंग विद माई क्रूकेड टूथ एंड माई क्रूकेड स्माइल. सो हियर टुडे वी आर गोइंग टू हैव to talk about how all of this can be rectified in case it's needed.
तो बेसिकली इन अ शॉर्ट टर्म आई वुड डिफाइन इट एज स्माइल डिजाइनिंग, जिसके बारे में हम आज बात करने वाले हैं क्लोव डेंटल के डॉक्टर किरण के साथ.
देखो, टेक्नोलॉजी आजकल ना बहुत ज्यादा आगे बढ़ चुकी है. आप जिस भी चीज के लिए अंडर कॉन्फिडेंट फील करते हो, यू कैन फिक्स एवरीथिंग एंड एनीथिंग ऑन दिस अर्थ.
तो फटाफट से अब ज्वाइन कराते हैं डॉक्टर को एंड आपको सारी चीजें बताएंगे. वी हैव अ फ्यू क्वेश्चनर्स. अगर आपके भी कुछ क्वेश्चनर्स हो डॉक्टर से, डू कमेंट एंड वील टेक देम अप एज वेल. सो फटाफट से इनको ज्वाइन कराते हैं, देन वील हैव अ नाइस कॉन्वर्सेशन.
यस, सुपर एक्साइटेड.
या
आपको आता है ऐड करना?
यस. Okay, so we have sent them a request, just waiting for them to be on board. Okay.
Hi, doctor.
Hi, Dr. Kiran. How are you?
Hi, Rahul, and hi, Ishita.
Hi, just a second. Volume बहुत कम है. Just a second. Yeah. Hi, how are you?
I'm good. Thank you, Rahul and Ishita, for having me here.
Thank you
We're
so
so
much.
glad you agreed to come with us. We have so many questions for you.
So a lot of people want to know a lot about smile and teeth. See,
a lot of people includes the two of us.
Yes.
Specifically.
See, obviously we all know smile is the most important asset on the face. अगर आपकी स्माइल अच्छी नहीं है, you're not gonna look fab. Like हम लोग डर्मेट्स पे हर किसी पर जाते हैं, but we never are concerned about our teeth, our smile, which is the
अभी
basis
अभी
of.
थोड़े दिन पहले I was watching this meme. So there was this person who didn't have his two teeth, front two teeth, and he didn't have an eyebrow. And the meme read कि everybody noticed that the person didn't have two teeth, but nobody noticed that he didn't have an entire eyebrow. And which is so true. Which is so true.
so true.
Like your face, like the first impact that you get is how beautiful and how
Right.
symmetric your smile is.
Right.
तो उसी
As
से
now-
yeah,
Yes,
please.
As you both have mentioned, that smile has a very important role. You are absolutely right. And as we all know, that smile is a curve that sets everything straight, right?
Very
Everyone,
true.
yeah. Everyone desires to be as beautiful like the Deepika Padukone face, right?
Exactly.
Especially
You
the dimples.
Yeah. You all spend a huge lot of amount in buying the lipsticks, buying the cosmetics, right? Finding the perfect shade for the lipsticks. But
Very true.
I don't know how many of you are bothered, like how are my yellow teeth are looking bad beneath that expensive lipstick.
Obviously.
Nobody actually goes to the. So let's talk about how this business of dermats and all this beauty industry, how this works. The bride is when a couple decides to get married, the bride is कि मुझे ये भी कराना है, I have to go to the parlors, I have to go to the dermats. But nobody actually talks about getting a teeth whitening session, or maybe like a structuring session, or just like a beautiful smile designing. But अगर कोई ऐसे
Because obviously photos तो तभी अच्छे आने वाले हैं when you're gonna smile and you're gonna have a very good smile.
Yeah, very true.
So आज हमारे कुछ क्वेश्चनर्स हैं आपसे रिगार्डिंग दिस ओनली कि जो स्माइल डिजाइनिंग होती है which is like particularly a smile designing thing, उससे रिलेटेड कुछ क्वेश्चनर्स हैं जो हम आपसे पूछना चाहते हैं so that audience also gets to know a lot about how smile designing is done and वो एक better smile कैसे achieve कर सकते हैं through Clove Dental.
Yeah. So let's start with what actually is smile designing.
Yeah.
Ishita and Rahul, I want to tell you both and our lovely audiences that what is a smile design. Smile design is basically a process which includes the variety of procedures to make your teeth aesthetically beautiful, aesthetically straighter, whiter, and a sparkling smile.
Got it.
Very
And what are the most common problems that are discussed regarding this smile designing?
Yeah, many of our patients report to us by saying like we smile design experts deal with the all age groups, starting from the younger age group with the 12-year-old.
That was my next question to you. Who is actually eligible to get their smile designed?
No, we, basically in Clove Dental we work as a team of specialists, right?
Okay.
So we all decide. The specialists decide that who will be taking care of the case and who will be, we all decide a treatment plan, right?
Okay.
So when the patient report to us, the younger people, they report by saying that I have a discolored teeth, I have a crooked teeth, as Ishita you mentioned, okay? So fractured teeth, we have a lot of spacing in our teeth, we want correction, right? And nowadays we are getting patients like who are getting married and who are getting engaged, they want that we want a teeth whitening. Specifically, they come to have a problem that we want a teeth whitening and a laser. We do a laser bleaching also, right? Which gives a very desired results and a very good results.
Oh, nice.
Yeah.
So I have one more question as well. So smile designing and teeth whitening, like I feel कि दोनों चीजें same है, right?
Wait a second. पहले I have a question. So I just want to quickly ask कि anybody can come and say कि I want to get my smile designed, or is there an age limit that people should consider before considering this?
No. Smile design, like for designing a smile, there is no particular age.
Okay.
A 12-year-old kid, they have a irregular teeth, right?
Yeah.
So they and their parents have a concern that his teeth is not looking good. So we want to treat him for it. So we have Invisalign treatment, the clear aligners, we straighten the teeth, which improves the smile, right?
Yeah.
in the Middle
And
Ages.
somebody, Devansh is asking us, are there any side effects? Which is like the most important question here. Anything that we want to fix in the body, we should be very sure that there are absolutely no side effects.
No, Ishita, it does not have any side effects. See, Smile Design is not a single treatment. It includes a variety of treatments, right?
Yeah.
It includes the veneers, it includes the composite veneers, laminates, bleaching, and the many other things. So there is no side effect, but there are precautions for it.
Yeah.
So
Yeah,
it is a
so
right
let's get started with like the breakdown of how the process is actually happening.
Coming down to that, you talked about veneers. I really want to know that what are veneers and what is this laser whitening treatment?
Yeah. These are like laser whitening I've still heard of.
But veneers, yeah.
Veneers.
I have heard about veneers, but I want to know a detailed thing that what veneers are.
Yeah.
See, the veneers are basically a tooth-colored material, a thin, delicate shell-like of thing, which we bond over the tooth, or in a layman term, we paste it on the teeth to mask the discoloration of the teeth or fill the spaces of the teeth.
Okay.
Got it.
Yeah. Makes sense.
And are these painful? Like veneers are painful and difficult to manage?
No, not at all. Veneers are not painful at all. And I generally see the way of treating my patients. I have a different psychology. If patient have a pain of grade 10, I tell that you will experience some pain, right? But if you don't have any pain, if you will not experience any kind of pain, then it is a complete painless process. But in highly sensitive patients, in extremely sensitive patients, we can numb the teeth also.
Yeah, makes sense.
We have
a couple of questions.
We have somebody asking us, how long does the teeth whitening last?
Yeah, it is a good question, but actually it all depends on the patient's own
care we take.
What kind of drinks or maybe food beverages they are having. Because in the whitening, when we are doing whitening, there are certain precautions that you have to take. Right?
Like, and what are those precautions?
Like hard stained food is avoided, like hard colored food. Then
for example, beetroot juice maybe.
Yeah, right, absolutely right. Then in the drinks, you have to avoid the dark coffee, red wine. Probably you can have
I'm like a beetroot juice fan and he's like a die-hard coffee fan, and दोनों चीजें ban हो गई है यहाँ पर.
Yeah, because see,
that's what you do. That's what you do to look good, right?
Exactly.
Right. It is just
we have to obviously take precautions on the health point of view as well. We don't have to eat junk. Similar as the
question. Wait, we have one more question, that is one person is asking, how is it different from cleaning and the polishing of teeth? So that the general cleaning that we get done like after 2-3 months.
I can tell you like a simple example with a facial kind of thing. Like we are scrubbing our face. This is a cleaning and polishing. And we are doing bleaching over our face. This is a whitening process, right?
But so, usually people usually say that bleaching is not a good idea, right? We've heard a lot of myths about why bleaching should not be done. It makes your teeth weak. It makes generally things weaker. What is your say on that?
No, it's just a myth, as you have already told it, that it's just a.
We have lost our connection.
No.
So guys, I think
there's some connectivity issue. So we'll quickly take up the. Can you hear us?
Yeah, I can hear.
But your video is kind of stuck.
Okay.
Yeah, no problem.
So it is not harmful at all. Like nowadays, younger people are coming who are getting married. As I have mentioned, we are doing the laser-assisted bleaching, right? Yeah. Which has
can you drop off and join again? We can't see you.
Yes,
Yeah,
yes, sure.
now we can.
Now.
Yeah. No, we can see you. We can see you.
Okay, okay, okay.
Yeah.
Acha, one
So,
more
I
thing I want to ask. One more thing, I have a question. So, पहले जो smile designing होता था, it was like a normal procedure, and how it has advanced over the years, and how Clove Dental has advanced all these procedures of smile designing.
Please say that we don't use braces now. I am so scared of braces.
No. We have a clear aligners also. So it's not like that. Everything requires a braces only. Okay. So if
And
we
it
talk
also,
about the
I think, depends on person to person. Ki what is the actual requirement of the person? How crooked the smile is? I think, right?
yeah, it is always yeah. Obviously, we ask the patient also, but the treatment planning is just uh, it is done like if a teeth has a very irregularity, it all depends on the scan what we are doing,
Yeah.
right? So every treatment can be done by the aligners. It's nothing like if a patient does not want braces, we have aligners. Yeah, for all kind of irregularities.
Okay. Another question that we have is how long does the teeth whitening
This is
last?
taken. This is taken. So we have a question. What is the cost of the procedure? So somebody is asking.
Yeah. The total
See,
cost of the process.
See, cost for exactly what?
Cost for
The smile designing.
So basically, let's talk about
Smile designing procedure involves a multiple things, right?
Okay.
So I cannot tell a precisely some cost for it because if it is a veneer, it is a different cost. If it is a bleaching, it is different.
Makes sense.
So let's talk about the veneers. Like, what is the cost for that if we take an average cost of the veneers?
It generally starts from 5 to 6,000, maybe 3 to 4,000. It starts from 3 to 4,000.
Which
I think that is very
affordable.
budget friendly.
Yeah.
If you can get a really good smile, 5 to 6,000 is very like economical, I must say.
Yeah. So once all of this process, let's suppose veneers, it's done, we should be taking the precautions throughout, or is it like a time frame that we should look at?
So in the starting, like when we place the veneers, we generally ask the patient to avoid the hard things. Avoid biting the hard candies, hard chocolates. Okay, because it is very delicate. Veneers are very delicate.
Yeah.
Second of all, if a patient has a grinding habit, if he or she grinds their teeth, then a night guard is advised, right? So all the precautions. Yeah.
Got it. Got it.
Okay.
Acha, one more thing I want to know कि एक तो treatment होता है laser whitening treatment and there is some one normal whitening treatment. तो इन दोनों में क्या difference है? Like, what is the basic difference?
Yeah, Rahul, very good question. In fact, our 100% patient ask this question when they come for whitening. So, a normal bleach and a laser assisted bleach. The difference is that in a normal bleach, we have to do 3 to 4 cycles to achieve the desired results, right? And a single cycle comprises of 20 minutes near about 20 to 25 minutes.
Okay.
But in the laser bleach, it is a complete half an hour procedures and a desired result can be seen after a single session only.
Oh wow, that is amazing. That is
Yeah.
quite an achievement, I would say, on the technology front.
Okay, so we have one more question. Somebody wants to know more details about bleaching process.
So he just told that it's like a session on session thing. Yeah.
The second thing is that in the laser bleach, the post-operative sensitivity, like patient generally says that bleaching कराने के बाद मेरे दांतों में ठंडा लगने लग गया, मुझे कोई problem, right? The people have such problems. So in the laser bleaching, it is a minimal or a negligible post-operative sensitivity. We apply the anti-sensitive gel, we recommend it to the patient, and while using the laser, when we use the laser, it's a very negligible sensitivity afterwards.
Okay. And what would be the cost?
Cost for laser bleaching,
laser
somebody
bleaching.
wants to know.
Even I want to know.
See, it is very, I must say that it is very budget friendly, as I have mentioned, the cost for the veneers. So, for that, you can come book an appointment with the Clove Dental.
We have surely
We are
visited Clove
surely
Dental
visiting.
and trust me, our experience was super. We
Yeah,
really loved it.
very,
ये हम
very
audience को भी
hygienic.
बताना चाहते हैं कि like
Great.
sanitization and all the things are really good
Yeah.
taken care of. Yeah.
And even the doctor.
And budget friendly तो हमने
Yeah.
experience किया ही है कि it is very budget friendly.
Yeah.
Like we took a couple of processes from Clove Dental and it was very budget friendly.
Yeah.
So right now though we are talking about smile designing, but we really know कि it is very budget friendly only.
Yeah, and
Yes,
even the
absolutely.
guidance that the doctor gave us about, doing stuff was very much interesting and very on the point. Like they didn't misguide us कि okay हमारे तो पैसे बन रहे हैं आप करा लो, nothing on those lines. But they genuinely told us कि okay this is the time that you should actually go for it and this you can avoid as well.
Absolutely.
Yeah.
We all like Clove Dental is working with all the specialists and in ethical manner. We all work in a very ethical manner.
Yeah.
Okay, so I have one more question.
Rahul has written all his questions कि मैं तो सब पूछूंगा आज ही.
Absolutely.
So, Acha, if people want to reach out to Clove Dental, how they can reach out, like any which way. And second thing is ki how Clove Dental is making it different from other people in the industry in smile designing.
See, like if you want to reach a Clove Dental, we have a call center number that is mentioned on the Google, right? If you will write a Clove Dental, there will be a call center number. You can call them. You can ask them that I reside here and I need an appointment in so and so clinic, and you can get appointment very easily.
Okay.
And you were talking about
Which is
that.
again very easy to like.
Yes.
Which is again very easy for a generation like us who's always on phones. It's like a just tap and book
Exactly.
type work.
Right, absolutely.
So I want to know a few more like things कि जो post procedure precautions होते हैं veneers में और laser treatment में
how are they different?
How are they different and what all precautions can like the people take? एक तो हमने देख लिया कि
as I have mentioned regarding the veneers and the bleaching, I have mentioned that you have to avoid the dark stained colored food items, then beverages you have to avoid. In the veneers, but for the veneers and the laser bleach, one thing is specific that you have to maintain your oral hygiene, a good oral hygiene, right? Second thing is for the veneers, as I have already mentioned, that you don't have to bite a hard candies or stuff, and that I have already mentioned. You have asked me a question that how Clove is different from other clinics.
Yeah.
That I have to answer. So I would like to mention that Clove Dental is equipped with all latest technology and advanced treatment options. Second thing is that Clove Dental provide the best treatment with the expertise of all the specialists under one roof.
Okay.
Like Clove Dental has all branch specialists over here. And a smile design procedure generally requires a multidisciplinary approach, right? Which requires the multiple specialists. So we have luxury in Clove Dental that we all are under one roof.
Okay, perfect. So a lot of people must be knowing about Clove Dental because I know it's a very huge chain with 350 plus clinics. Acha, we have an interesting question. So somebody is asking, is it a myth or fact that toothpaste has a color coding which is related to chemicals present in it? I don't know how is this a question, but
no, this is a question. So if you see the toothpaste, उसके वहाँ पे ना पीछे जहाँ पे जब हम रोल करते हैं जब खत्म हो जाता है उसके वहाँ पे there are different patches made of different colors. So I think the person is trying to ask what are those colors. You must have not seen, I know, but
no, it's not related to any chemical. It's not like that.
Okay. So this is a myth, totally. Okay.
Yeah.
Another question we have: what is the difference between composite, lamination, and veneer? Which is a very, very interesting question, I think.
See, basically, composite is a material that we place over the teeth.
Okay.
Veneers are something, a tooth-colored ceramics, you can say. That is a permanent solution.
Okay. So lamination, you're trying to say over the time it will wear out, whereas veneers will not wear out.
See, composite veneers, they generally tend to discolor with time.
Okay.
Okay.
But your Emax veneers, they are more naturally looking and they do not wear off. Their color does not change. It remains same as when we have placed.
Okay.
So that's why
We a little while ago we spoke about good oral hygiene, and I would like you to actually pinpoint what comes under that umbrella.
So the good oral hygiene generally includes not only the twice brushing, but actually we have to consider our tooth. Like our tooth has a four surfaces. We have to clean our teeth accordingly. Like not like we are brushing horizontally and we are done with it. We have to floss. We have to take care. If any food is getting stuck in between our teeth, you should definitely consult your dentist for it. Like I'm getting food lodged here, you should definitely consult.
Sure.
Okay, we have one more question. So, is veneer a zirconium crown?
See, veneer, the material depends. The material of choice depends on the dentist, like what kind of material the dentist is using, right?
Okay.
So,
Yeah.
EMAT veneers and the zirconium veneers, these are two different veneers.
Okay, okay. Another question that just came to my mind is, as a dentist, do you actually, promote or like advise your patients to go for an electric toothbrush or the normal toothbrush?
See, a normal toothbrush and an electronic toothbrush, they both have a different working thing, right? If the patient is wearing the braces, that is not manageable by with the normal toothbrush, right? Then we recommend a electric toothbrush maybe, which can clean all the surfaces.
Yeah.
So it depends on the patient to
And
patient.
otherwise, generally, like for people who don't have braces and generally like normally brush on their own, you recommend the normal brushes and not the electric brush.
Yes, yes.
Anything else you have to ask?
Yeah. So, I am surely planning for a smile designing treatment.
Yeah.
What do you recommend us, like both of us, for that?
With our smiles.
See, like from here, I cannot see
Of course,
clearly.
of course. We'll come.
We'll personally
Yeah.
come to the clinic and we'll surely get us
Yeah,
checked up,
right.
and we'll surely be there for the smile designing treatment. I am very impressed with this.
Right, right, right. Because as I mentioned that we deal with the different age groups, right?
Yeah.
So old age people also come to us that they have missing teeth, they have no teeth in their mouth.
Yeah.
So
yeah.
we rehabilitate by implants, bridges, and implant supported dentures, hybrid dentures.
Mm-hmm.
So in the young patients, it depends on their problems.
Got it.
Makes sense.
Thank you so much, Dr. Kiran. So, guys, I hope all your queries and questions were answered.
Yeah.
And I think this is the best clinic we have personally visited, and it's very budget friendly as well. जब हमने ये बात भी की. So, thank you so much once again, Dr. Kiran, for answering all our questionnaires, and we'll hope to see you soon and get our smile designed.
Thank you. Welcome.
Yeah. Bye-bye.
Bye.